Regarding the borders and the angles of the scapula, we already talked about that. The scapula has got three borders and the three angles, and we'll discuss what is the significance of the angles and the borders. Okay, so we have three borders. One is the superior border, and then you have the medial border, and then you have the lateral border. Superior border is somehow related to somehow superior medial part, and there are very important muscles which are attaching to the superior border, like the trapezius. And then you have the medial border. Medial border is somehow related to the thorax, it like the rib cage when you're talking about the anterior surface. And then you have the posteriorly, you have a relationship of the medial border with the vertebral column. Then obviously you have the lateral border, and lateral border is somehow related to the appendicular skeleton. It's a part of the glenoid cavity, and this glenoid cavity is fitting up the head of the humerus and making up a very important joint, the shoulder joint, with the ball and socket joint responsible for the most of the movements of the upper limb. Then when you talk about the angles, so again, we have three angles. One is the superior angle, the other is the inferior angle, and then another one is called as the medial or lateral angle. So you have superior angle, inferior angle, and a lateral angle, and you have a superior border and a medial border and a lateral border. Now the question arises why there is a need to divide the scapula into these borders and these angles. See, the inferior angle, at the inferior angle of the scapula, this is a part just like the spine of the scapula, which can be palpated, and the inferior angle is the part where the levator scapulae muscle attaches, and it's a part of the rotational group of the muscles which are responsible for the circumduction movements of the shoulder joint. Then you have the important part, which is the coracoid process, and then you have the acromion process. So the coracoid and acromion, they are making articulation with the clavicle, and somehow building a connection with the appendicular and the axial skeleton. And then you have just medially to this coracoid process, you have a notch which is called as the suprascapular notch. That means that is located above this suprascapular fossa, subscapular fossa. And then this notch is converted into a suprascapular foramen by the help of transverse suprascapular ligament. So see, if there is this is a notch, okay, and and then there is a ligament, the transverse suprascapular ligament. It attaches like this, and it's converting this into a foramen for the passage of the suprascapular nerve. And suprascapular nerve is the important nerve which is not only supplying the levator scapulae muscle, but also supplying to the rhomboids, and again making up important group which is called as the rotational group of the muscles. Then you have the borders. The superior border, we talk about the medial border, we talk about the lateral border, and then you have the anterior and the posterior surface. Now, if you could see here, you can see this depressed triangular portion in the center. Okay, the borders and the angles, they're thicker as compared to the centrally flat depressed portion of the scapula. The spine is thicker, the acromion is thicker, the glenoid is thicker, the acromion and the coracoid process, they are thicker, and the surfaces which are somehow articulating, or they're somehow making up important structures for ligamentous attachment or the insertion of the muscles, they're somehow thicker, and it's you have a cancellous and a compact bone, but the rest where the overall architecture of the bone is thinner, so there is most of the time the cartilaginous part of the bone as compared to the rest of the body. So remember, three angles, two surfaces, and three borders. Okay, so superior border, lateral border, and the medial border. Lateral border is somehow making up the glenohumeral complex, and medial border is related to the thorax, the costal margin in the rib and the costal cage, and the somehow vertebral column as well. And superior border is somehow related to the important structures like, the clavicle and the sternum and the first costal cartilages. And the inferior angle has got the spine of the scapula, and the inferior angle are the parts which can be palpated.